Buscaino, and I'll be doing this webinar with you regarding men's sexual wellness. I'll give it a couple more minutes for some people to log on. It is exactly 6 o'clock, so I'll give it another minute or so. But while we're waiting, let me introduce myself. Like I said, my name is Dr. Kristina Buscaino. I am a urologist who practices with Advanced Urology Institute in the Naples and Fort Myers office. I did my training for residency in Michigan, and I did a 1-year fellowship for sexual medicine at USF in Tampa, Florida. I decided to stay in Florida long term. So ultimately, I do practice in Naples and Fort Myers. So I'd be more than happy to see you if you're interested in meeting me in person to discuss this lecture or any other issues that you may have. So why are we discussing sexual wellness tonight? So it's very important that you discuss sexual health with your physician and with your partners, because it can definitely play a role with your quality of life. It is definitely important to protect your physical, mental, and overall long-term health, both for you and your partner. So definitely important to bring up with your physician and your urologist. So why are we discussing sexual wellness tonight specifically for men? There have been a few studies that demonstrate that men specifically do not bring up these issues with their partner or with their urologist. So this is why we ran this special seminar, one for Men's Health Month, which is June, and then also because we are aware that patients do not bring up these issues while you meet with us in the office. So again, another survey that demonstrates what men are worried about when it comes to their sexual health. 44% of men are worried about erectile quality. 39% of men are worried about having a lower sex drive and libido. 36% of men are worried about low testosterone. So all of these things, granted, a lot of men are concerned about it. Again, only 2 out of 5 people seek professional help with their urologist. So again, we're here to touch base on specifically low testosterone levels, Peyronie's disease, erectile dysfunction, and vasectomy if you are interested in undergoing that. So low testosterone is very common. It occurs when your body doesn't produce enough testosterone, and unfortunately it does decrease as time progresses. So the older you are, the lower your testosterone is. Most men who do have a low testosterone do have some sort of metabolic syndrome where they can have diabetes, high cholesterol, and high blood pressure. So when it comes to these things, it's important that you live a healthy lifestyle to maintain the highest levels of testosterone that your body can produce. So main symptoms for testosterone levels, it can be both mental, emotional, energy-wise. So specifically, when men come in to bring up these symptoms, they're complaining about low energy, loss of energy, gaining weight where you can't continue a workout if you are an active person. You start noticing a decrease in muscle mass, increased body fat. You may also have hot flashes, heat sweats, and a reduced sexual drive. And then in terms of other things that you may notice, you can have less confidence because, again, you're gaining weight, you have less sex drive, your partner may notice, and you can also have poorer sleep and less concentration and poorer memory. So again, these are all things that you should be keeping an eye on in terms of your symptoms. And again, if you have these symptoms, bring them up with your primary care doctor or your urologist. So testosterone does play a role, not with just any of these symptoms, but it does play an important role in maintaining bone health, cardiac health, mental and psychological health. So again, as mentioned before, you can have emotional distress, you can have low libido. And again, these are all things that keep your body healthy. So if you are concerned about the low testosterone, you do need to check your labs. It's not something that we can just prescribe you. There are a few labs that we check to see what prescription or what regimen works best for you in terms of replacing your testosterone. So when I do your blood work, I do check labs. They have to be first thing in the morning because your testosterone goes up and down throughout the day. So if you're planning on getting labs, whether it's with me or your primary care doctor, it has to be before 10 a.m. So again, check testosterone, your hemoglobin, hematocrits, your estradiol levels, and some enzymes that are released from your brain. And then from there, we decide what the next steps for you would be. The treatment regimen does come with a lot of options. So the standard gold standard is with injections. So there are injections that you can utilize. You can either inject them in your muscle or in your subcutaneous fats. If you hate needles, depending on where you inject, it'll be the determining factor in terms of which needle size you need to use. So again, injections are probably the cheaper option. Most insurances do cover it as long as we can prove that you're symptomatic and that you have low testosterone with your blood work. Another treatment option is testosterone gels or solutions. So these are topical ointments that you can place on your body every day. I typically recommend that you use it on a non-hairy portion of your body, which is typically your shoulders. So depending again on your labs, we'll decide which gel or which drops work best for you. It's important to note that if you are around grandkids or if you have children of young age, you wouldn't be a good candidate for the gels or the topical options, only because it can transfer to them. So we do not want them to go through puberty early. So again, if you're around young children because of family and things like that, that would not be a good option for you. There is a nasal spray that recently came around. You use the spray every day. I do have some patients who utilize it and they prefer it because they hate injections and they're around children. So it is a good option, but we do have to watch your labs more closely with this. Another option is pellets. So these are inserted in the office. Depending on what your labs are, we typically insert 1,200 milligrams of testosterone every 3 to 6 months. Now, these are released slowly, so you don't have the typical ups and downs as you do with the gels and the injections. So if you do have those ups and downs and you want to avoid those, the pellets would be a good option for you. There are also new medications that are testosterone itself, and those are oral pills. They're new, like Jatenzo and other options like that. But again, you will have to check your labs with whichever regimen you utilize. It's important to note also that if you are interested in preserving your fertility, you cannot be on any exogenous testosterone. So the reason being for this is that once you're on testosterone, it turns your production of sperm off. So there is a alternative that is not exogenous testosterone, like the gels, the pills, the injections, and things like that. It's an off-label use of clomiphene. So clomiphene and off-label HCG, those actually hyperstimulate your brain to tell your body to make testosterone on its own. So again, if you're interested in preserving fertility, along with increasing your testosterone, it would also increase your sperm production and make your sperm more healthy. So these are just important things to know when you are deciding what type of regimen you want to move forward with. Peyronie's disease is the next topic we will talk about. So Peyronie's disease, I'm sure many of you have seen the commercials. It's basically a indentation, curvature of your penis that results in possibly loss of length on when you have your erections. Now, typically the Peyronie's disease starts with some sort of trauma. So whether you were having sexual intercourse or and then there was some sort of trauma, like let's say you missed the vaginal opening, or let's say you accidentally hit it before insertion. That can be a problem. That can be some trauma, and that can cause the inflammation, that can cause the scar tissue that would ultimately cause a plaque, ultimately leading to a curvature, indent, which ultimately leads to loss of length. So with the plaque itself, it is common. It's more common than you think. Most men don't talk about their penis, what it looks like, how they injured it. It just doesn't happen amongst men in conversations like when you're playing golf. But it is undertreated because there is a lot of embarrassment when bringing it up to their partner or bringing it up to their urologist. And statistically, again, 6 to 10% of men have Peyronie's. People just aren't talking about it with each other. So the main signs and symptoms of this are, again, the penis can point in any direction. It can point up, down, left, right. You can lose length. You can have pain with erections, and it can also cause erectile dysfunction beyond where the plaque is. Now, when you have pain with your erections, this is typically the acute phase of the Peyronie's. So if you come into my office with pain with erections, we have to stabilize the plaque first. So that's started with medications that help, again, stabilize the plaque to prevent it from growing and to prevent the morphology of the penis from changing for a longer period of time. Because this is important only because I can't treat your penis while the penis is changing. So we have to make sure that the morphology is stable before we decide to treat. Now, treatment for Peyronie's, I typically do a penile ultrasound and a Doppler in the office to determine how firm the plaque is, how thick the plaque is, and to see if even a needle or an injection can treat the plaque itself. So there are many options. The conservative way to treat Peyronie's is with certain devices with traction. Specifically, the Restorex, this is FDA approved. And basically what it is, it's a device that points your penis in the opposite direction and helps mechanically break the plaque up. So for example, if your penis is pointing up, like this picture, this is considered a dorsal curvature when it points towards you. You would use the device and it would point the penis downward. You would have to do this every day, a few times a day, to help mechanically break up that plaque. The next option would be medication. So when you see the commercials online, you see the bent carrot, and that's typically what their marketing is right now. It's a bent carrot. But this is a medication. It's a collagenase that helps break up the plaque. Now, that medication is only good if you have a curve that points up, like this picture here. If it points downward, then that is not a good option for you. The injections itself, it is a cycle. So there's 2 injections per cycle. You can also do this up to 4 times. There is a limitation of sexual activity for 4 weeks between each cycle. The reason for that is because you can get what we call a penile fracture if you're too active with it too soon. So it is a hard rule, literally and figuratively, that you cannot have sex or masturbate for 4 weeks after the injections. And then for surgery. So again, this is for if you hate needles. This is if you're saying you're not injecting my penis with a medication. This is for the guys who have a penis that points downward. There's lots of surgical options for this. Now, if you have a large plaque, you can sometimes remove the plaque and put a graft. But that would worsen your erectile quality. If your penis points straight up, we can do a penile plication, which is basically I make an incision at the bottom of the penis and I put a suture internally to help straighten the penis. And then ultimately, if you have a mixture of both a curvature and erectile dysfunction, we can do a penile implant, which I will discuss later in this webinar. So we're kind of switching. We're going to talk about a vasectomy first, and then we'll talk about the erectile dysfunction afterwards. Now, vasectomy is a permanent form of sterility. So when you meet me in the office or when you meet any urologist, you have to be sure that you do not want to have more children. The reason for this is because the tubes are fairly small. You got to think about the tubes like a small piece of fettuccine, or not even like a linguine, so even smaller. But the vas are very small. So separating them for a vasectomy is actually quite simple. We can do that in the office. It takes about 15 to 30 minutes. We do use numbing medication so you don't feel pain during the procedure. Now, every urologist does their vasectomy a little bit differently. The ultimate end goal is to make sure that no sperm comes out with your ejaculatory fluid. So you will still have fluid after a vasectomy because most of your fluid comes from your prostate. It's just you don't want any sperm to travel through the vas to get to the outside world. So the vas deferens, again, is that communication between your testicle to the penis, and then that's how the sperm does get out. Now, if we do the vasectomy in the office, it's fairly quick. Again, it takes about 15 to 30 minutes. Recovery, I typically say don't do anything crazy for about a week. No heavy lifting, no strenuous activity, no masturbation, nothing that can cause any micro trauma to the scrotum. Only because during the procedure, we use instruments to stop bleeding. And if any of those clots fall off, it can cause a lot of issues with your post-vasectomy course. Now, when it comes to the vasectomy, I do make a good point that it doesn't change what your semen looks like because most of your fluid does come from your prostate. Your sperm only makes about 5 to 6% of your ejaculatory fluid. Now, it won't affect your erectile dysfunction and it won't change your orgasms because the nerves for your penis that allow for both of those things, they run at the top of your penis and they're not anywhere near your vas. It doesn't prevent STDs. So if you are concerned or if you have a new partner, it is recommended that you still use condoms. And then the reason why I want to make sure that you are sure that you don't want to have children is because the reversal itself is not as successful as the vasectomy procedure. So with the vasectomy, you have a 99.9% chance of it being successful. With the reversal, it's only about 60 to 80%, depending on a lot of factors like how long ago was your vasectomy, how much of a portion did your prior urologist take off for the vasectomy. So there's just a lot of factors that play a role. Now, if you're nervous and you're concerned that you won't be able to manage to sit through a vasectomy, we do have laughing gas in the Naples office. In Fort Myers, we do offer Valium. So if you are nervous, then again, these are both available to you to help you relax for your procedure. We also do offer doing it at a surgery center where you will be completely asleep. Whether you're awake or if you're asleep, it doesn't change how I do my vasectomy. I do them the same regardless. So again, it still takes about 10 to 15 minutes to do the procedure. Now, I did not mention that for a vasectomy, that when the vasectomy is complete, it doesn't mean you're sterile. So there's still sperm that lives beyond where I do the vasectomy and where I do my work. So you have to quote unquote clear the pipes. So that usually takes about 30 to 40 days or 30 to 40 ejaculations or 8 to 10 weeks, depending on which comes first. So when you leave a sample, we send you home with the kit. You do the kit from home. You ejaculate into a cup. They look under the microscope and they say dead sperm, sperm that's not there, sperm that's not moving. Then we know that the vasectomy is a success. And then at that point is when you'd be able to stop utilizing protective measures like condoms, birth control, or anything like that. It's very important, though, that after the vasectomy, you use protection. The pull-out method does not count. Just wanted to throw that out there. Now, onto erectile dysfunction. I did mention this briefly in the Peyronie section. So erectile dysfunction is multifactorial. So a lot of times when patients come to see me, they think it's for one specific cause. So there are a lot of factors that play a role when it comes to erectile dysfunction. It is also more common than you think. Statistically, 1 in 5 men over 20 years old will have some sort of erectile dysfunction in their lifetime. So it's very important that you bring this up. Now, as time progresses, just like with your testosterone decreasing with age, your erectile quality will also decrease with age. Now, that could be because of nerves, it could be because of medication, it could be because of a surgery that you had. There's just a lot of things that play a role. Now, erections work in a way that you need enough blood flow to get to the penis to compress your veins. So it's very important that you do have a good cardiovascular history because it does rely on good blood flow. You do have to be aroused for your nerves to be activated to cause your arteries to relax. That causes the vasodilation, that causes the blood to engorge the penis. Now, when the penis has enough blood flow, that's what compresses the veins. So there has to be enough blood flow to compress your veins. Otherwise, the blood will leave through the veins. So they work hand in hand with each other to make sure that you have good erectile quality. So again, like I had mentioned, there's a lot of causes for erectile dysfunction. So cardiovascular disease is one of the main reasons that you could have erectile dysfunction. Diabetes can cause erectile dysfunction because it does damage the nerves. Obesity and smoking also damage nerves. So it's very important that these are addressed if you are concerned about erectile dysfunction. Now, other causes for erectile dysfunction are medications. So specifically blood pressure medications. It can also be antipsychotics or antidepressants. These are all things that can cause erectile dysfunction. Pelvic surgery would include like colon surgery, having your prostate removed, having radiation to your prostate. The nerves for your erectile quality travel around your prostate. So any prostate surgery that requires removal or radiation can cause your erectile dysfunction to worsen. It's important to note that if you had erectile dysfunction prior to your prostate removal for, let's say, prostate cancer, it will never return to something better. It can return to your baseline of poor erectile quality before, but this is just important to note that moving forward with your erectile dysfunction, what treatment would be best for you, depending on, again, what surgery you had or what treatments you had. Now, when it comes to options, we'll definitely get into that. But if you want to try to reduce your erectile dysfunction in a more natural way, diet, exercise, things that can get you off certain medication, these are all things that can play a role. So again, we did touch base on erectile dysfunction and diabetes. So the main issue with this correlation is that it can happen sooner because of nerve damage. They have a lot of studies that demonstrate that erectile dysfunction medications are less responsive if you are a diabetic. And again, this is mostly because of nerve function. There is, again, a heart disease connection. So if you do have erectile dysfunction, I will often recommend that you see a cardiologist. So ED will precede cardiovascular symptoms or silent cardiovascular disease in almost 70% of the cases. So it is important to note that, again, I will likely send you to a cardiologist or have you meet with your cardiologist to get a workup to see the health of your heart and the health of your arteries. Now, this is a good picture that depicts why cardiovascular disease is a major factor when it comes to erectile quality. Now, looking at this picture, you can see that the penile artery is only 1 to 2 millimeters in size. So it takes a lot of pressure to get blood flow to the penis. So again, it's very small. The main artery that goes through your leg, that's 6 to 8 millimeters. So you can see the size difference and why it's important to keep your heart healthy so that blood flow can get to the smaller arteries. So in terms of treatments, oral medications are probably the most conservative. So this increases the blood flow to your penis and it does require sexual stimulation. You can't just take a Viagra or Cialis and say, hey, I'm going to mow the lawn and expect to get an erection. You have to be stimulated by a partner or with yourself. Now, it is effective in 50 to 85% of men. Every man has a different enzymatic profile in their body. So Cialis may work well for you, where it may not work well for someone else who's on Cialis. So it's important that we try different options. It's not as effective in men with diabetes because, again, it does require nerve function, or with men who have had prostate surgery because, again, your nerves can get damaged during surgery. Sometimes it is covered by insurance. I've been utilizing GoodRx a lot lately because it does drop the price down of these medications. AUI also has a pharmacy where you can utilize these medications also. It does take about an hour to work, so you do have to time when you're going to be active. And some medications do require you to take it on an empty stomach. For example, Viagra, it works best if you have an empty stomach. Cialis, not so much. You can take it with or without food. And it can last it stays in your system for quite some time, depending on the medication. For example, Viagra, you can take every day as needed, versus Cialis, you can only take every 3 days because of the half-life of the pill. Now, there are side effects, as with most things with medications. The main side effects you can get are headaches. You can get facial flushing, where your face turns bright red. You can get nasal congestion, vision changes, and a prolonged erection, which the latter one is fairly rare when it comes to just oral pills. So that last one, the prolonged erection, can happen if you mix other medications with it. So if you have any of these side effects, they may not be a good option for you, because who wants to have sex when their face is bright red, and who wants to have sex when they have a headache or they have reflux? So if you have these side effects with the medications, there are other options. Now, the vacuum device is exactly how it sounds. It brings blood from your body to your penis. So as we discussed the pathophysiology of how erections work, you have to prevent the blood from leaving. So the way that you do this is with a constriction ring at the base of the penis. Now, it can be effective depending on your suprapubic fat pad. It can be helpful if you have a girthier penis. It really just depends on your anatomy. 86% of men, though, decide to move forward with other options because they may not get enough firmness or rigidity. It is loud, it's noisy, it's bulky, it's hard to travel with, and then sometimes it can be painful and it can cause bleeding if you are on any blood thinners. So again, it's exactly what it sounds like. There's different options. There's a hand one that you can use to pump up, and there's a battery controlled one also. They both work equally well. It just depends, again, on which one you're most comfortable with. So again, the way that you prevent blood from leaving the penis to go back into your body is with the constriction ring. It's very important that if you decide to use a vacuum device, is that the ring is malleable and that it's stretchy. If you use anything plastic or anything firm or metal, you will not be able to remove it. There will be a lot of edema and swelling, and it will be very difficult to remove. And you may be seeing me in the emergency room. So keep that in mind if you decide to do this option prior to meeting with your urologist. Now, the next option would be penile injections. So a lot of men do choose the injections because they can be more spontaneous. They work faster than the oral pills, and they are not noisy like the vacuum device. So there are different concentrations when it comes to the injections. Now, if you're worried about the size of the needle that you use to inject your penis, it's very small. It's a 31 gauge needle. So it is very thin and it's very short. It measures about 1 centimeter to 1.5 centimeters, depending on the needle that you get. Now, I just don't send you home with a needle for your penis and the medication. I actually teach you how to do the injections in the office. We have a lot of reading material. And again, I do bring you in the office. I do an ultrasound to actually demonstrate if the medication works for you, because depending on how you respond in the office on the ultrasound and with the medication itself, that'll decide what strength we utilize. Now, we can't start at the strongest strength possible because that would lead to a prolonged erection. And I know it may sound nice, but a prolonged erection for more than 4 hours is actually damaging to your penis. So it's very important that we find the right dosage for you. So reasons men decide not to utilize this is because sometimes it can be hard to travel with, is because it has to stay cold. You can have pain with the injection. If you have bleeding, it can develop scar tissue, which can ultimately lead to Peyronie's disease. And sometimes it's just not as spontaneous as you want it to be. So these are reasons why patients may change their mind in terms of injection, use the vacuum device, and so on. The last option that we have available in the Southwest Florida region is the penile implant. So they are surgically placed. There are a lot of good studies that demonstrate high satisfaction rates with both patients and their partner. Now, there's two different types of implants. The most common is the inflatable one, where that can mimic your flaccidity and your erections. The malleable one is where you place 2 rods in the penis and you basically move it up, down, left, right, whatever direction you want to you place it to utilize it and to conceal it. The surgical approach is different for these, but again, the main goal is to give you an erection that is firm enough for penetrative intercourse. So the reasons why the options differ is because some men want a malleable because they've had a lot of abdominal surgeries, and sometimes that can often cause issues with the healing of the implant. So when you discuss with either me or with another urologist, it's important to let them know your surgical history. Oh, let me talk more about the implant. I thought there was more. So with the malleable implants, the incision will be different. It'll either, if you're circumcised, it'll be closer to the head of your penis. If you're not circumcised, it'll be at the bottom. The inflatable, again, approach does change depending on your surgery. So if you've had abdominal surgery, like a hernia repair or a prostate removal, it makes it fairly difficult to get the reservoir in a safe space with only 1 incision. So you may need 2 incisions. But as you can see in this picture on the right, this is a type of implant. There's 2 inflatables that are out there, both with Coloplast and with Boston Scientific. So as you can see here, the reservoir, if you have what we call a virgin belly without abdominal surgery, you can typically put it near the bladder behind your pubic bone through the 1 incision. You have the 2 cylinders that go into your penis. So you have a cylinder that goes on both sides, you have a cylinder that goes on each side of the penis, and the pump will actually sit in your scrotum. So I like to explain it as a 3rd testicle. But the pump itself, it sits anteriorly or in the front of your scrotum. The only reason I do that is because if I put it towards the back of your scrotum where it's less visible, if you sit, it can auto-inflate. So I typically put the implant in the front, the pump in the front of your scrotum. Everything's internalized. No one will really be able to tell if you have an implant unless is that they're both outpatient procedures. So you'll be in the surgery center and you'll go home the same day. I typically have my home healthcare team monitor you to make sure that your incisions are healing well. You do not go home with a Foley catheter unless you cannot pee. You may or may not have a drain and you're going to help with the healing, but that's a game time decision when it comes to the OR. Now, this concludes my actual webinar, but I'm more than happy to take some questions. So we can definitely go to the questions now. And so I'll read the questions. They're all anonymous. So if you're concerned about, people knowing what you're asking, they're all anonymous. So I'll read through the questions one by one. And if there's any other questions, feel free to chime in. And if I don't get to your question, or if you want to discuss further, I'm more than happy to meet you in either the Naples or the Fort Myers office. All right, so question. Labs for testing testosterone levels conducted in the Naples office. Can your current urologist order it? Yes, they can order it. So we do have blood draws in our office, but as I stated earlier, it does have to be before 10:30 a.m., only because anything after that, the labs aren't as real, and they're not as, what's the word I'm looking for? They're not as consistent if you do them in the afternoon. So they do have to be before 10:30 a.m. If you don't have an appointment with your urologist, you can call our office and we can get you scheduled for a lab and a subsequent follow-up with whoever your provider is at our AUI office. So testosterone treatments, are there hormonal effects? So the goal of low testosterone treatment is to increase your testosterone, which would ultimately increase your hormones. So that would be the ultimate goal for putting you on testosterone. And again, it is important to decide what option works best for you upon your discussion with your urologist, because again, if you're on kids, if you're trying to have kids, that all plays a role in terms of what we decide is the next treatment for you. So another question that's currently being asked is a medication that can help with low testosterone that preserves your fertility. So that would be clomiphene, which is an oral pill, or HCG, which is an injection. So both of them are good options to increase your testosterone and preserve your fertility. So I actually put my patients on either of these medications if they have fertility issues. So it works hand in hand in terms of hyperstimulating the brain to both make sperm and increase your testosterone levels. So Sparks is another question that I'm getting, the combination of Viagra and Cialis. So it is an option. I do believe that their concentrations are different from what I would put you on in the office. Now, they are more expensive. If you're trying to save money and you're trying to go through insurance, Sparks does not take your insurance. So typically what I do is I do some sort of dual therapy with a 5 milligram Cialis every day with a stronger Cialis or a Viagra, Levitra, something along those lines as an as needed dose. So those in conjunction with each other, they are very similar to Sparks, but it's covered with your insurance. So again, just something to think about. All right. Which manufacturer is preferred for implants and are recommended? So I trained with both implants when I did my fellowship. It really just depends on your anatomy. So if you have a longer penis or a girthier penis, one implant may work better for you. If you have a shorter penis or a skinnier penis, another implant may work for you. So it really just depends on your anatomy. I will definitely talk to you about the options in the office and explain why I believe which implant would be best for you. The pumps are different also. If we're going strictly on the pump, I do use Coloplast Classic pump more, only because the risk of the malfunction rates for that specific pump is the lowest out of all of them. So that is why I use a classic pump if both implants are a good option for you. All right, so for implants, is stimulation lost, including ejaculation? So stimulation will still be there. So if you have a fellowship trained surgeon, the risk of nerve damage is very low. So you do have your penile nerves that are kind of near your or above your pubic bone. I typically do my incision at the bottom of your penis, so there's no nerves that are present there. Now, if you still have your prostate, it will not affect your ejaculatory function. If you've had radiation, or if you've had nerve damage, or if you've had your prostate removed, then you just don't have ejaculatory fluid because you don't have your prostate. So if you still have your prostate, it wouldn't affect your stimulation or your ejaculatory function. So in terms of growth on a scrotum with a penile implant, does this create an issue? So it really just depends on what the growth is. If I'm concerned about infection, I would definitely treat the infection first. If it's something superficial, it doesn't affect where I place my implant, then we can avoid that spot that we're concerned about. If it's a growth that's concerning for cancer, I would obviously remove that first before moving forward with a penile implant. So it's very important that when I examine you, I do look at the penis, I do look at the scrotum. So if there's any limitations, that would be addressed prior to the implants. And then last question I have listed is regarding a low dose Cialis. And for this specific person, it's been effective and they're wondering how long it'll be effective. So that's a loaded question because there's a lot of things that can cause erectile dysfunction. So as time progresses, your nerves may change, so the medication may not work anymore. So again, there's just a lot of factors. It's not necessarily the medicine not working anymore. It's your body changing or you adding another medication that's worsening the erectile quality. So those are all the questions that I have listed. If there's anything that you want to discuss in person or you're nervous or embarrassed about asking in the questions, feel free to contact my office. There's going to be a link that pops up on the bottom left that will take you directly to my page to request an appointment with me. Be sure to request me specifically if you want to talk to me or if you want to talk with your urologist that you're already seeing, feel free to make an appointment with them. We are all versed in talking about erectile dysfunction, Peyronie's disease, low testosterone, but I do have extra training because of my fellowship in Tampa. All right, so feel free to click on that to make an appointment with me. And if there's any other questions you'd like to discuss with me in the office, I am available. So that will conclude our webinar for tonight. Thank you all again for joining me. We went 38 minutes, so fantastic. We will see each other in the office, hopefully. But regardless, thank you for listening to my talk, and I hope it was beneficial for you. And I hope you have a good night.